Hi, I'm Ashley.
And I'm Kayla, and in this video we're going to be talking to you about STIs.
Come on.
Let's talk about sex, baby. Let's talk about you and me. Let's talk about all the good things and the bad things that may be.
The point of this video is to debunk the shame surrounding STIs.
Even the vocabulary that's used to talk about STIs, it has shameful connotations, like saying that you're clean if you don't have an STI implies that someone who does is dirty, when that isn't the case.
If you suspect you have an STI, the best thing you can do for yourself is go to your doctor and get tested.
There's no shame in getting tested. In this video, we're only vaguely touching on 6 STIs, but there are a lot others out there, so make sure to educate yourself.
The reason that we're talking about these 6 specifically is because they affect young people the most. The first STI that we're going to be discussing is trich. Trich affects 31% of young women aged 14 to 49, and it's more common in women than it is in men. Trich is spread through vaginal intercourse and sharing sex toys. To prevent trich, you should use latex condoms and always clean your sex toys. Some of the symptoms of trich in women include vaginal discharge that often includes bleeding and odor and burning while peeing. Another common symptom includes pain during intercourse. If you suspect you have trich, when you go to your doctor will perform a vaginal swab and oftentimes a pelvic exam. Then you will be prescribed antibiotics. Another important thing to keep in mind is that you should not engage in sex while you are on your antibiotics, and you should ask your doctor when you can engage in intercourse again.
Another common STI is HPV. 75% of Canadians will have HPV at least once in their lifetime. That is 10 to 30% of adult Canadians. The highest rate of people who get HPV are individuals under the age of 25. 2% of women who have HPV will have genital warts as a result. And 11 to 25% of HPV is cancer causing. So it is a myth that all HPV is cancer causing. HPV is transmitted through skin-to-skin contact, and that includes skin-to-skin contact while performing oral sex. There is not guaranteed protection from HPV when a condom is used, but it does help. It is super important that you get tested regularly, and if you do have HPV, find out all the information about the type of HPV you have and what treatment is best for you.
The third STI that we'll be talking about today is chlamydia, and it's most common amongst 15 to 24-year-olds. Chlamydia is spread through skin-to-skin contact, which may include oral, anal, or vaginal sex. To prevent chlamydia from spreading, you need to use condoms and dental dams during all sexual contact. Symptoms of chlamydia include a burning sensation when you pee, unusual vaginal discharge, bleeding between menstruation cycles, and pain during and after sex. Another common symptom is fever and chills. However, obviously this can be in a lot of things. Treatment for chlamydia is an oral antibiotic, and it's really important to keep in mind that you should not engage in sex with your partner or partners until 17 days after you completed your treatment.
Herpes is another common STI that is spread through skin-to-skin contact. 1 in 5 people have herpes, and 80% of the population that does have herpes doesn't know they have it. While at this point in time there is no cure for herpes, that does not mean that you cannot engage in sex with a partner who has or does not have it. Just remember, when it comes to any STI, it is super important to be open and honest with your partner. Herpes is another STI we felt it was really important to talk about because there's a lot of stigma and shame around this particular STI. 1 in 5 people have herpes, and 80% of the people who do have it aren't aware that they do. One of the myths surrounding herpes and STIs in general is that you can get them from sitting on toilet seats. That's not true. Very rarely do STIs have the capacity to stay alive outside of the body. So, sitting on a toilet seat will not lead to herpes or any other STI. Another stigma that sometimes is associated with herpes is that people who do have it can only have romantic or sexual relationships with other people who have it. This is not true either. It's very possible to be in a monogamous or open relationship with somebody with herpes as long as you're open about it with your partner or partners and you discuss the proper prevention methods. There have been cases of couples who have been together for long periods of time and when one partner has it and the other does not. If you are in a relationship with somebody and you do have herpes, remember that when a breakout is occurring, to not engage in any sexual contact, and when a breakout isn't, remember to use latex condoms. For more very helpful information on herpes, you can go to dynamoclear.com. This website explains what to do if you do have herpes and how to help prevent the spreading of it between yourself, your partner, or your partners.
Another common STI among young people is gonorrhea. In Canada alone, gonorrhea is the most popular STI amongst people aged 15 to 19 years old. The spread of gonorrhea occurs through skin-to-skin contact in vaginal, oral, and anal sex. Like with all STIs, the best way to prevent gonorrhea is to use latex condoms and dental dams. One of the main issues with gonorrhea, though, is that the symptoms very rarely show. For example, 80% of women who have gonorrhea are asymptomatic. This means that none of the common symptoms show at all in them. Oftentimes, gonorrhea is misdiagnosed as a UTI. That is because a lot of the symptoms are very similar. Another issue and symptom of gonorrhea is that there is rectal pain and bleeding. If you suspect that you have gonorrhea, your doctor will perform a swab on the suspected source of infection. The treatment for gonorrhea is an oral antibiotic, and it's very important that you finish all of the medication given to you by your doctor. It's also very crucial that you go back 3 months after you finish your dosage. This is because gonorrhea can come back if it's not treated properly.
The last STI we're going to discuss today is HIV and AIDS. HIV stands for the human immunodeficiency virus. An important thing to remember through this next section while discussing HIV and AIDS is that they are not the same thing, and HIV does not always necessarily lead to AIDS. There are 3 stages of HIV. The first is the acute infection stage. Acute infection stage is when you are actually infected with HIV, and this could happen before you're born. Second stage is the clinical latency stage. This is when you are actually diagnosed with HIV, and the third and final stage is AIDS. It's really hard to tell the symptoms of HIV because they are very similar to those of the flu, and a lot of people express it as the worst flu ever. So it's fever, swollen glands, sore throat, headache, pains in your joints. HIV can be spread through any sort of skin-to-skin contact in which bodily fluids are exchanged. This is why it's super important to use latex condoms either as a condom or a dental dam, because it acts as a barrier between one person's bodily fluid and the other person's bodily fluids. What happens with HIV is that your immune system normally is able to clear viruses, but that isn't the case with HIV. Rather, it attacks your T cells, which are your white blood cells that help attack viruses. HIV only becomes AIDS when a certain number of your T cells have been destroyed and you only have a few left. Antiretroviral therapy, which is basically taking HIV medication every day, helps keep your HIV level low. This means that it helps with the prevention of letting the HIV virus attack and kill a high number of white blood cells. Antiretroviral therapy can make it so that you can lead a full, long life with HIV without it progressing into AIDS. While that treatment is available, there still is no cure for HIV and AIDS. One thing to remember is that being HIV positive can happen at birth, but that does not mean that you have AIDS. The A in AIDS stands for acquired, which means that over time, your HIV could develop into AIDS. More than 1.2 million people are living with HIV in the United States alone, and 1 in 7 people, so roughly 14%, are unaware of their infection. These numbers include people of all types of sexual orientation. This is to say that no matter where you fall on the sexuality spectrum, you can be at risk of contracting AIDS or HIV.
We just really want to make it clear one more time that there's no shame in having an STI or suspecting that you have an STI.
It's super important, however, that you're honest and open with the people that you are engaging in sexual activity with, and that you get tested on a regular basis even if you don't think that you have an STI.
We don't want to scare you guys with all of this information, but it's just really important that you know about your own sexual health.
The more knowledge that you have, the easier it'll be to enjoy the safe sex that you do have.
So have fun. Enjoy sex.